Hello, and thank you for joining me again today on the Finding Hope After Loss podcast. Don't forget to subscribe so you don't miss any future episodes. If you like the show, please leave a review or rating on Apple or Spotify. It only takes a moment and really helps the show reach more loss and infertility families. Today's business spotlight is from Kelly from Rest of the Nest. Here is what she had to say.
Hi, my name is Kelly Abernethy, and I am a lost mom. After having a healthy baby boy, my husband and I tried for another baby and lost 2 babies, one after we had already seen the baby and its heartbeat on the ultrasound. It was devastating to me in a way I never could have imagined, but it gave me the inspiration to preserve a piece of baby's breath in resin and make it into a necklace. I paired the necklace with my now trademark phrase, planted on earth, blooming in heaven, to capture the hope that even though we can't see our babies, they are thriving in heaven and one day we will all be reunited. Baby's breath also symbolizes everlasting love, so it's a very fitting flower. Since then, I have created a business called Rest of the Nest, and the sole mission is to honor loss and celebrate life. I make everything from customized engraved sonogram lockets to keychains with baby's breath to necklaces with fruit to represent each unique gestational week. I make each and every piece by hand because I believe that every single loss is unique and deserves to be honored as so. I've sent thousands of necklaces and keepsakes all over the world, and it reminds me that while loss is a universal pain, it also is something that binds us together. I am definitely a more compassionate person because of what I experienced, and I have so much empathy for anyone walking through loss because I know how it feels. My hope is that each and every piece I make brings someone comfort in their healing journey and helps honor their baby in a very tangible way. If you would like to learn more, please visit my website, restofthenest.com. Thank you.
Thank you so much, Kelly, for sharing about your business with us. Today, I am talking with Randi. She had trouble getting pregnant and went through fertility treatment, including several rounds of IVF. She then went through the loss of her twins at 21 weeks due to an incompetent cervix. Randi then lost her next baby at 14 weeks, likely due to an infection. She is still hopeful she will get to bring a baby home soon. Hello, everyone. Today I am here with Randi. Randi, can you tell us a little bit about yourself?
Yeah, my name's Randi. I am 35. I live in Michigan with my husband and my 2 dogs. We spend our time hanging out with the dogs around the house, hiking, we go kayaking. I spend a lot of time gardening and I do some crafts.
Can I ask what kind of dogs you have?
We have a pit bull husky who's 6 years, no, she's 7. She just turned 7. And her name is Rory after, well, my husband likes to say it's after the Detroit Lions because Rory's their mascot. Which I like, but I also like Gilmore Girls, so I say it's from both.
Gilmore Girls would be my guess, yeah.
And then we have a Maltese Shih Tzu Yorkie. His name's Avery, and he is 14. And
wow.
yeah, he's my little baby. I had him for 1 year before I even started dating Stefan, so he's my little baby.
Do they get along okay?
Yeah. The big one thinks she's the same size as her little brother, and he has like no spatial awareness at all. It's funny.
I think that's the funniest when like big dogs think they're like little dogs. They're like, you don't fit like that.
She definitely does. She loves her little brother and he loves her, but it's like any older sibling relationship. He just like tolerates her at times.
Like, you're here, but no, I want you to go away. So do you mind sharing a little bit about your story?
Yeah, it's kind of a long story and it's pretty tragic. So, a little bit of backstory. I grew up in Michigan my whole life. I have 2 younger sisters. We're all 5 years apart. So I was always kind of the one, not mothering them, but I was always had that mothering instinct and babysat. And I always knew I wanted to be a mom. So my husband and I started dating in 2012. And then 2015, we got engaged. And then we got married in September of 2016. And we started trying for kids right away. Wedding night, I started researching all the things, talked to my doctor about getting on prenatals, started prenatals. She said, if it doesn't happen in a year, come back and we'll discuss further testing. So the year came and went. She sent me to a gynecologist who did an HSG sonogram, and we went on vacation actually the week right after. So we went to Ireland, which was an amazing trip. And we came back and I'm like, okay, we still haven't heard from the doctor. I'm going to call him. So I call, and the front desk lady, I tell her my story, like what's going on. And she's like, oh, your results came back all normal. You're good. You don't need to come back. I'm like, okay. So I hang up the phone and I'm in the airport because we just landed. And I start crying to my husband. I'm like, everything's not normal. Like, we've been trying for a year, nothing's happened. So go back to my doctor. She sends us to another doctor, and he puts me on Clomid right away. Looking back, he never tested my hormones or anything. So I go on Clomid. The second month I'm on it, I'm at work and I have excruciating pain where I am now crying at work, and I ended up leaving work and called the doctor, and he's like, oh, you're just ovulating. It just go home, relax, try to take a bath. It's just ovulation pain. I'm like, okay, yeah. So I knew it wasn't normal. And one of my friends, her sister did the NAPRO technology. So I reached out to her and learned more about that and started cycle syncing and tracking things. And I went to another doctor via her. She introduced me to another doctor who, looking at my tracking sheets, found out that I was showing symptoms of endometriosis. So we decided to do a laparoscopic procedure in 2019. So at this point, we were trying for 3 years. Found endo. She removed the adhesions. And then after I healed from that, she put me on Femara, which, if women who have endometriosis have a hard time with Clomid because it can increase your estrogen, which in endo patients, their estrogen tends to already be higher. So that's what was causing pain. That's why I was experiencing more pain than normal. So Femara wouldn't do that. So I went on Femara. I was on Femara, I don't even know, probably a year and a half. Nothing was happening. So we seek now was this fourth opinion, and we're now discussing artificial reproductive stuff. So we decided to do IUIs and medicated IUIs. So this is where I start the injections. And, I remember doing the first one, being so excited. I'm like, oh, it's gonna work. So we would go to the IUI day, and my husband, would give a sample, and then we would turn it into like a date day. Cause, I wanted some sort of like intimacy. I'm like, well, if we can't be intimate, at least let us have a date day or something. So he would give a sample. We would go out for lunch and do something. Then they would call us and say, hey, we're ready for you. Then we would go back and they would inseminate me, and we would go home and wait 2 weeks. And then they would always call me while I was at work. So I would just let it go to voicemail because there was no way I was answering that at work. I would get home, and my husband and I would listen to the voicemail together, and 5 rounds of IUI, it was always negative. So the doctor said, with endometriosis patients, if it hasn't worked in 3 times, we usually push them to IVF. So I said, okay, well, we got their IVF prices and procedures. We wanted to get another opinion. So we actually ended up moving doctors again to another doctor. And thank God we found this doctor, because he is, I don't know if you've been lucky enough to have a doctor who's like an angel on earth. Like, he is just amazing. We did IVF with him. The first time, he transferred 2 embryos. It didn't take. So we had like a discussion, and we talked about trying to include steroids, so progesterone. And so the second time we did that, and then we transferred 2 embryos. And each time I do an egg retrieval, I only got 2 embryos. So both these cycles, I had to do a full cycle. So we transferred the 2 embryos, and I researched like all the things to do in the 2-week wait, as one does. So I'm like wearing socks every day, putting my legs up the wall, like zenning out, drinking the pomegranate juice, the pineapple.
I know a lot of those things.
Oh yeah, French fries. And then we got the call, and it was positive. We were pregnant. And, we cried. We were so happy. And I just remember the first week, like, we didn't know, did one of them take or did both of them take? We don't know. So we had to wait 2 weeks for our first scan. And then I went for our 6-week scan, and this was during COVID. So my husband had to stay in the car and we FaceTimed him. And the nurse said, she's like, oh, I see 2 babies in there. So we found out we had twins. We were pregnant with twins. And excited isn't even like the right word. There's no word for how we were feeling. We were over the moon. Everything was going good. I had morning sickness, which I welcomed, even though I hated throwing up. I welcomed it every time I threw up. I'm like, you know what? I'm pregnant. I love it. I'll throw up all day if I have to, if it means I get a baby. Everything was good. We went for our 19 weeks. We went for the anatomy scan. We had to write down the genders in an envelope. We went and got cupcakes made where they filled in, and my husband and I video recorded ourselves eating them and, showing the camera, and they were both girls. On 20 weeks, we had a gender reveal with our family where we dressed up our dogs in little pink outfits and tutus.
That sounds adorable.
It was very adorable. And there's just so much happiness around that day because, all our friends and family knew our story and us trying so hard. And then 2 days later, it was a day after Father's Day. I woke up in the middle of the night and my underwear were wet. And I was like, that's weird. During IVF, I'm doing different suppositories and you get a lot of discharge. So, I was kind of used to it. So I just changed underwear, went back to bed. Well, I woke up in the morning and I had more. So I told my husband, he's like, you should call the doctor. So I called the doctor and I said, it could be nothing, but just, safe, go to the hospital, get it checked out, make sure you're not leaking amniotic fluid. So we go to the hospital, and the hospital we went to is the one we wanted to give birth at because it's known in the area for having a good NICU. So we're like, well, with twins, it's a chance they could be born early. So this is where we want to go when we do give birth. So we went there. They put me up to triage, get me in the room, and she does the ultrasound scan. She's like, oh, I see both babies. The heartbeats are good. Both the sacs seem to be intact. She said, it's probably just normal discharge, but let me do a quick amniotic swab to see if you're leaking. So she went to do the swab. She comes up and she said, I'll be right back. So before this, she said, you're probably good to go. You'll probably be leaving. Does the amniotic thing. I'll be right back. She leaves. Like 5 minutes later, she comes back with a MFM doctor, maternal fetal medicine doctor, who tells us that my cervix is dilated anywhere from 3 to 5. They can't really tell because one of the bags are bulging out of my cervix, and that we would potentially lose one, if not both babies. So in a matter of 5 minutes, we went from everything is completely fine, you'll probably be going home, to you're going to lose one or both of your babies. And after he told me that, or told us that, I just remember staring. There was like this cabinet on the wall, and I just remember staring at that cabinet and just like wanting to rip it off the wall. Like I was just so angry and mad and like in disbelief. So they kept me at the hospital for 3 days and, monitored me. They put me at, I forget what they call it, but it's a position of the bed where you're like angled like this. So hopefully gravity helps. There was no changes within 3 days. So they said, we'll send you home. If you have any bleeding or anything, call us or come right back to the hospital. So, okay. Well, the next day I went to go to the bathroom and noticed some blood. So we went back to the hospital. My doctor, who was my OBGYN at the time, who was going to deliver the babies, came in. That's the only time I've ever seen her at the hospital. Ended up being there for almost 2 weeks. She came in the room, checked my cervix, and said she's constipated, and left the room. Yeah.
Okay.
Yeah. So then they proceeded to give me, this might be TMI, but they proceeded to give me an enema, a suppository, and then milk of magnesium. So for the next 3 days, I was at the hospital, couldn't get out of bed. So I was using a bedpan.
That sounds miserable.
My bowel, yeah, it was horrible. And I remember having this one nurse, she was so nice. Like after I would go to the bathroom, she would help me clean up, and she would bring a bedpan over so I could wash my hands, and she was just awesome. So we were there for a while, and it got to the point where the babies kept moving and they started pinching my urethra. So I wasn't able to pee by myself. They had to keep doing straight catheters. And this one point, the nurse came in to do one, and she said, Stefan, which is my husband's name, she's like, I need you to sit down. So he sat down, and she said, just when I went to do the catheter, I can see baby's leg sticking out. So at some point while I was at the hospital, one of the sacs broke and my baby was coming out. So then they rushed me to the delivery room, and, were monitoring me. In this meantime, while they were monitoring me, I started to get an infection. So that meant that I could no longer save both babies. We were hoping that if we were to lose one baby, they would do the test just to make sure I didn't have an infection and do an emergency cerclage to keep that other baby safe. However, once I got the infection, they said that they can't do that because it would put me and the baby at risk. So at that point, they induced me. And then shortly after, contractions started. And I remember them asking me if I wanted like pain medicine. And I was like, yeah. And I don't know what I thought they were going to give me, but they ended up giving me like morphine. And it was like the button that you press. It's like every 15 minutes or whatever. Looking back, I wish I wouldn't have been on that because it made a lot of memories and things blurry, and I don't know, you just couldn't fully encompass everything that was going on because you're kind of messed up. First baby came, all the doctors and nurses were there. They wrapped her up. She was born sleeping right at 21 weeks, is the day turned 21 weeks. Placed her in my arms. There wasn't any more activity. So the doctor's like, okay, we'll be right back. So everybody left the room. It's just my husband and I. Mind you, this is the first time we've ever had children. I've never given birth. We weren't at the point where we were taking birthing classes or anything yet. We didn't know what we were doing. A couple minutes later, I start feeling the need to push. And I looked at my husband. I'm like, she's coming. Like, I don't know what to do. I don't like this part of the story. The baby came out. I'm on morphine and holding my baby that's sleeping in my arms. My husband goes out into the hallway and says, hey, we need a doctor. Like, the baby's here. Nobody came in. One of the students came in, looked in the room, peeked, noticed no other doctor was there, and left. Finally, it was probably only like 5 minutes, but it felt like 10 minutes. Finally, a doctor came in, grabbed the baby, and he said, you want to see the baby? And I was like, of course, like, I want to see the baby. And he gave me the baby, and I got to hold both my babies, which at that point they were both sleeping. But looking back, that's one thing I don't like saying I regret, but I wish I would have reached down there and grabbed her, So we were with them for a couple minutes, and a nurse came and asked if we wanted her to go clean them up. So they went and cleaned them. They actually took pictures of them, which I'm forever thankful. And then we were able to spend almost 2 days with them via a cuddle cot, which kept them cold. So we were able to, spend time with them. My mom and dad and my husband's mom came to see them. But during this time, both my placentas did not come. So they still have to get the placentas out of me, and they're not coming. And with my history of endometriosis and scar tissue, they didn't want to do a full DNC because they didn't want to make more scar tissue. So they gave me some pain medication and started doing the manual removal, which is extremely painful. They did it twice. They got little bits. The third time, the doctor came in, and this was the only time I had a female doctor do it, and it was the worst time, which in all my history of like gynecologists and stuff, I have found most of the men are very gentle, and the women are the ones who are like, get right in there. But she was like, I'm just going to check your cervix. I'm like, okay. And then all of a sudden she starts doing it. And I'm not on pain medication at this time. I screamed bloody murder. It hurt so bad. the nurse was like, she's not on medication. They're like, oh, it'll like, just 1 second. Let's just try it for one more second. I'm like dying. I remember saying the F word at one point, and it was just awful. Nothing happened. And then she left and she's like, okay, we'll try again in like 15 minutes. But if she can't, if we can't do this, she has to go for a DNC. And at that point, I lost so much blood that if I had to do a DNC, I would have had to have a transfusion beforehand. So 15, 20 minutes came by. They gave me the pain medication. And I'm sitting there during these 15 minutes telling myself, like, I have to do this. Like, if I want to have another baby or a chance to have another baby, I need to get this out of me. So I remember just sitting there. I was like shivering because the infection was like breaking, and I was just doing yoga breath and like trying to like push. So then they came, they gave me medicine, and they did it, and they were able to get all of it out. And shortly after that, we were able to go home, but we had to say goodbye to our girls. They gave us some nice like pink knitted blankets, and we were able to wrap them up. And they were in like these purple boxes that, the funeral home had to come get. And it was just very hard, leaving that hospital. And we left with these memory boxes and not a baby. And I remember sitting in a wheelchair waiting for my husband to pull the car around. And I was sitting there waiting, guy comes in carrying an empty baby car seat. I'm like, oh, he's going to get his baby. And my husband and I just went home, and it just felt like a nightmare that first week. I didn't know how I was going to survive. I didn't know. I've always believed in God, and I was just like, why? It doesn't make sense. Like, why would you let us even get pregnant? So the first month was awful. After about a month went by, we knew we wanted to try again. So we contacted our IVF doctor, and he said, now that we know you have, which is called incompetent cervix, which is why I lost the twins. So your cervix starts opening too quickly. He said, unfortunately, a lot of times the only way we know a woman has that is with a loss, because usually there's not a way. If they were to have done a transvaginal ultrasound at the anatomy scan, they may have been able to see it funneling. But unfortunately, they didn't do that. And a lot of places don't do that because of insurance and billing. And I think that's ridiculous. I think it should be standard, because even if you asked every new mother, hey, this isn't covered, but you got to pay $100 or something,
We'd pay it.
Yeah, exactly. Most people are like, fine, do whatever. Just make sure the baby is safe. So I think that's BS. So he said, because of the incompetent cervix, he would no longer be transferring 2 embryos. We would only do 1, because it increases the risk of that happening again. And I could make the choice to do a cervical cerclage or a transabdominal cerclage, which is higher up. But with that one, you have to have C-sections, but it can stay there for the rest of your life. The cervical cerclage, you get anywhere from like 10 to 13 weeks, and it's just a stitch. And then once you hit, I think it's 34 weeks, they cut it, because that's when it's safe for baby to come. So we did another round of IVF. Again, got 2 embryos. Don't know why I have a normal AMH level, but for whatever reason, my body doesn't respond to the medication. Lucky us. We transferred the 1 embryo. We used the steroid. I did all the things again, and I got pregnant. It was very scary. I was so happy to be pregnant again, because that's all I wanted. So we lost the twins on June 27th of 2022, and then we got pregnant again in November of 2022. So this point, it wasn't even half a year yet. And, so it's still very fresh, still very scary. I'm scared I'm going to lose this baby, but all I ever wanted since losing the twins was to get pregnant again. So at this point, I'm in contact with a high-risk doctor, and he again is an angel of a man. He is one of the best doctors. He puts a cerclage in at 12 weeks. And I remember sitting there for the cerclage. So I don't know if you're familiar with the cerclages, but you can't eat. So you go to the hospital in your first trimester when, you know, you don't eat, you throw up. So you're not eating, you go to the hospital. When they're finally ready for you to come back, they give you a nerve blocker in your back and it numbs you from the waist down. And then the doctor will go in with a speculum and put the stitch on your cervix. And then they'll monitor you for a couple hours and then you can go home. Well, I remember sitting in the room waiting for the doctor to come in, and I didn't realize I was crying until the doctor came in and he's like, "Why are you crying?" And I think it was just like being back in a hospital and the smells and the sterilization and everything just like triggered, you know, being in the hospital with the twins. So we had the cerclage done. 2 weeks went by. I was going to have my first appointment with my regular OB/GYN, which ironically was the first doctor that we had with the twins. I'm like, you know what? I'll give her a second chance. I only, you know, I know she's a busy person. That's probably why I only saw her once. I'll give her another chance. So we had an appointment scheduled on 14 weeks, like the very day of 14 weeks. And my high risk doctor at that time, he said, you know, be good for a week because I'm going on. He had to go to some conference, like a doctor conference for a week. And he's like, be good and I'll be back in a week. I'm like, okay.
I'll try.
And, you know, as you know, I'm sure every time you go to the bathroom, you're checking and making sure you're not bleeding or anything's weird. Sorry, I'm like jumping kind of back now. A week before my 14-week appointment, I was at work in the office and I went to the bathroom and I wiped and I had mucus. And I felt like it was a lot and it was kind of tinged brown a little bit. I was like, okay, that's weird. So I call the doctor's office and get a hold of the nurse and she's like, you know, it's probably normal. It'll be okay. Like, we'll see you next week. Like, okay. So the day of the 14-week appointment, I'm working from home, go to the bathroom and I see little baby blood clots. And I'm like, what the heck? So I call the doctor's office and say, hey, I'm scheduled to come in there later at 2. I'm noticing this. Should I just go to the hospital or what do you want me to do? And they're like, oh, let me ask the doctor. Comes back on the phone. No, we'll see you at 2. Just, you know, stay there. We'll see you at 2. I'm like, okay. About an hour goes by. I started having cramping. And I'm like, oh, you know, maybe it's like round ligament pain already. And it happens again and again. And at this point, like, it's getting worse. And looking back now, I know that those were contractions. My husband kept asking me, do you want to go? Do you want to go? I'm like, no. Well, then finally I had another contraction and I had a gush of blood. I said, well, we got to go. And I called the doctor's office when we're leaving the house and say, I am having a miscarriage because I just gushed blood. I'm on my way to Hurley. And they said, okay, we'll let the doctor know. Thanks. Okay.
Wow, real compassionate.
Yeah. So I get off the phone. You know, my husband leaves our subdivision and it's 25 outside of our subdivision. He's like zooming and a cop pulls him over. And I'm like, my husband sometimes can have a short fuse. So I'm like, calm down. It'll be okay. Like, he doesn't know. It'll be okay. Meanwhile, I'm like having contractions and like freaking out in my own head. And the cop comes and Stefan's like, you know, I'm sorry. My wife is in the middle of having a miscarriage. And the cop was like, oh no, like, do you want me to call an ambulance? And Stefan's like, no, we're just gonna go. And he's like, okay, go. Get to the hospital. I have the cerclage at this point. So there's a stitch holding, you know, everything in. And I'm waiting in the waiting room in the ER. And my husband comes in and he's like, did you tell them that? I'm like, I did tell them, like, they know that I have a stitch. And he went up there and he's like, you have to like help her. So they finally got people from like the OB/GYN came down and grabbed me and took me up. It was a hectic situation. Other doctors everywhere, nurses everywhere. A nurse was trying to do an ultrasound on my belly and was hurting because I was having contractions and stuff. And I just remember her saying, no, there's no heartbeat. And then they had to figure out how to cut the stitch. So then they cut it. More blood came. Not even like 5 minutes later, the baby came. And I just remembering it, like at the time, like, what the hell is happening? Like, why? It was awful. My placenta again didn't come. And they said, we can try doing it manual. And I said, you can try once, but that's it. So they tried once, didn't get it. And then they sedated me and did it manually, but I was sedated. So when I got rolled back into the room, I remember seeing my mom and dad, and one of my sisters was there, and they got to see the baby and they held the baby. We again had a cuddle cot, so we got to spend some time with the baby. They found out that I was infected when I was at the hospital. When I got to the hospital, I had an infection. And I remember a couple days before that, I was feeling sick. Like, when you get the flu and you like move your eyes and you have that pressure in your head, I was getting that. And so I was like, I'm probably just have a flu or something. Well, no, I had an infection. And so I had to stay in the hospital until the infection went down, which they put me on antibiotics and all the things. Once the infection went, we had to leave the hospital, and we again had to say goodbye to our baby. So we left the hospital again with nothing but a memory box. Went home. Things were okay for a week. And then I started feeling very similar to how I did with the infection. And I started getting super bad lower back pain where I couldn't sleep. It was just killing me. I called my high risk doctor and tell him, and he said, I want you to come in tomorrow for an ultrasound. I go the next day to an ultrasound. They do an ultrasound and see that I have a pretty good sized chunk of tissue still in me that has like a blood supply still going to it. And so then they scheduled me for a DNC, and I went and had a DNC. And so nobody really knows the reason why I lost. Violet was her name, our 14-weeker. But we think that there may have been infection left over from when we lost the twins that was kind of like dormant. And then once I got pregnant again in the cerclage, everything, kind of festered up in there. And then until my body was like, no, we got to get rid of everything.
Oh, it was the same type of infection? Do you know? Did they?
I don't know. They did do not an autopsy, but they did a biopsy of the placentas both times. And they did have a couple different bacteria in them. I remember E. coli being one of them. And my high risk doctor, said like E. coli should not be up there. But yeah, when I lost the twins, I took a month off of work. And then once I lost Violet, I told my husband, I'm like, I need more than a month. Like, I can't function. I can't, it's hard to even open my eyes in the morning. So I ended up taking 3 months off, which looking back, I'm thankful I did, just to have, more time to heal and try to live and grieve my losses. Yeah, it was rough. And then after the DNC, I healed, went back to my IVF doctor, and we did another HSG and found out I had scar tissue that was blocking one of my tubes. So I had surgery to remove that. Had to wear a fun balloon catheter for like a week. And that was in April of 2023. Since then, we have done 4 transfers with IVF, and none of them have worked. So at this point, we're just still trying, to be hopeful, and it's just very, very hard. We have 3 kids, but they're not with us. Like, we don't have anything to show for them. We don't, people ask when they meet you for the first time, like, oh, do you have any kids? What do you say? I say
Hate that
no.
question. Like you don't want to always like go into it, but then
Yeah,
you feel like guilty when you
exactly.
don't say like I have three, but then you don't want to have to like go into the whole thing. Well, I have three, but they're not here, and it,
Yeah.
it makes you sad.
Yeah, because it's like you want to honor your babies, and they existed. They're your babies. And but at the same time, it's such like an awkward conversation to have with people. Like, what do I say? Do I just, trauma dump on this person that I just met?
Like, do you really want to hear it all? Because I'll
Yeah.
tell you.
Yeah. It's just been a struggle. And then, you see friends and family members having babies and basically like passing you in life. There's people who, Steph and I have met boyfriends and boyfriends, and then they finally find the one, get married, have pregnant, onto their second kid. And it's like, we're just still standing here. So that's really hard.
It is. I mean, it's hard because it feels like you're just at a standstill, but like everybody else just keeps going and life just keeps passing, but you're like, I can't fully live the way that I want to live or how I expected I would live because like I don't have any living children here with me.
And that's the thing. My husband and I just had this conversation about, even with kids, people who don't have kids and choose to have like a childless life, they get to go on vacations and like soak up all the opportunities and things you can do without kids. And yeah, we could take all those vacations, but since we have to do IVF and fertility treatments, that's not really an option for us, because it's like, if we want to have a chance of having children, we need to save our money and for a chance. We are also pursuing adoption, and that's not easy or inexpensive. And I just laugh anytime I see somebody give somebody else the advice of, just adopt. Like,
Like it's
first
so
of all,
easy, just like, I want that kid. All right, it's done. Yeah.
adoption's not for everybody, and that's fine. Second of all, it's not cheap and it's not easy at all. And so I don't know. I don't know why people give that advice, but
I don't know either. I feel like they think it's helpful somehow, but it's like, no, you're not understanding what you're saying.
and there's a lot of, as you know, a lot of comments like that where people just, I had somebody, a close family member, tell me, I it was before we lost any of the children, but she said, I think for some reason just some folks aren't meant, they aren't compatible to have children. I'm like, so is
Thanks.
like my husband and I don't love each other enough to have kids? Like, is that what you're saying? Like,
A
it
horrible
was
comment. I'm sorry. That's
so hurtful. And you know that people don't mean to hurt you by the things they say. It's just those people have never been in the position that you have, and you don't ever want them to be. I would never wish this on my worst enemy, but it still doesn't make it not hurt when people say things.
especially when it's the people that are close to you and like know the situation. It's not like some stranger just making a comment. Like it's
Yeah.
somebody close to you that you think would be understanding.
Yeah. And I will say, like, following up to that, my husband and I are very lucky. We have very supportive family and friends. Like, I have a group of girls that I've known since elementary school, and we're still friends, and they're like my sisters. And we feel extremely lucky to have a good support system. They still will ask me about my girls and remember things. If I post something on Instagram, they'll say I love you and I love them. I love my nieces. And so that's nice, just to know that people remember them and
Yeah.
acknowledge that they existed.
It's hard when you feel like you're the only one that remembers, because obviously we think about them every day. We miss them every day, but it does make him seem almost less real when like other people don't remember them. It's like, but they were here, like they're real people.
Yeah. Yeah, my mom, she's been super supportive throughout all of this, but she asked me one time, she's like, I never know if you want me like to bring them up or say anything about them. And I said, I'm thinking about them 24/7. Chances are, if you bring them up, they're already on my mind. Like, I like it when people say their names because it means you didn't forget them and, they live on through people. And I feel like it honors them by having people talk about them. And I told her, I said, if I'm having a sad day where I can't talk about certain thing, I'll tell you. But it's more comforting when people do.
Yeah, definitely. It's like I'd rather you bring them up and it make me sad than you never bring them up and then that make me sad, you know?
Yeah. And it's hard because you see like your friends, like I've had close friends and family members get pregnant and have baby showers and since our losses, and it's just hard to watch all that happiness and love surround them and knowing that we weren't able to have that. That part's really hard.
It is hard. Do you go to the baby showers or do you excuse yourself?
So before any of our losses, before we did IVF, we were doing IUI, and one of my best friends got pregnant and I helped her throw her baby shower. And I remember, being excited to help her and have her vision come to reality. But I was fine at the shower. And then I went to the bathroom and I remember crying in the stall and, trying to like pull myself together to go back out. So that was hard. And then just recently, my youngest sister got pregnant. I just had a niece, another niece, in her baby shower. Steph and I went to early to help set up, and then we left before it started. So I think that was good for me because I was able to still feel like I was helping my sister and, because everybody deserves to have those happy moments
Right.
and to be celebrated. So I wanted to be there for her, but I knew I couldn't sit through, all the happiness and the gifts. So we went and helped set up a little bit and then left right before it started.
I think that's a great compromise though. Like you can still be there privately if you needed to cry, if you needed, but like you're still showing support and then you can protect your own mental health and leave and not deal with
Yes.
all the other stuff.
And I have other people throughout the years who have reached out to me because they've had trouble getting pregnant and they ask me things. And that's one thing I tell them is don't go. Don't even, if you even can't even bring yourself to buy a gift, don't do it. If you know somebody else is going and you really want to get that person a gift, Venmo your friend $50 and have her go get a gift.
Yeah.
Don't put yourself through that. Like, you got to protect yourself.
I really
And
do feel like people expect us to just be happy, like put our own feelings and our own like mental health aside and be quote good people. Like it's like we're supposed to sacrifice our own mental health to be happy for other people, which
yeah,
makes no sense.
yeah, just slap a smile on your face and get through the day. Yeah.
Because nobody wants to deal with you being sad over there. Wow, how supportive. You
Yeah.
know?
Yeah, there's a lot of situations like that where you feel like you just gotta suck it up and just like swallow it down because you don't want to inconvenience anybody or make anybody else sad or have them think, oh, here's Randi, she's gonna talk about her dead kids again. Like
I don't mean to laugh, but it's
it was
like
pretty funny. It's fine. Um,
sometimes we have to, get by with that dark humor, right?
oh my gosh, yes. I was just talking to my mom about that. I'm like, if I don't laugh, I'll cry. So
Yeah. Like, so I might as well make jokes at my own expense, okay?
yeah.
Now, I
Yeah.
remember like we didn't go through IVF, but we did go through other fertility treatment. And I just remember thinking like, because I have PCOS. So I
Mhm.
remember thinking like, okay, the infertility and the getting pregnant was the hard part. Now the pregnancy shouldn't be the hard part. Like, did you ever have feelings like that? Like,
Oh
okay,
yeah.
I got through that hard part.
Mhm. Yeah, I remember when I was pregnant with my twins and I was having the morning sickness and stuff. I'm like, I feel like people who had to go through infertility should have a smooth, easy sailing pregnancy. But fortunately, that's not the case. And, that's one thing I felt like after we lost our twins, which I don't know if I said their names. Their names are Lily and Grace.
I
Or
love all their names.
thank you. I just remember feeling that, like asking God, like, why would you even let us get pregnant just to take them away? I don't understand. My husband and I did everything right, like quote unquote right. We both went to school and got degrees. We got married. We have good jobs. We're saving our money. We have such a nice like house and love and family members to share with this child. And it just didn't make sense.
Yeah, I definitely had a lot of anger towards God after losing Jasmine. I mean, we found out about her diagnosis at like 13 weeks, and we're basically given like a 50-50 chance. But I prayed about it every day, like just, I try to stay hopeful. And then when she was taken from me, it's just like, what the hell? Like, why? Why are you doing this? I was really mad for a long time.
Yeah, it's hard not to be. And then you have thoughts of, well, is it because I didn't pray enough? What more could I have done, you know, to deserve this? And
It makes you feel like you're a bad person or something, even though we know it's not our fault, but like we feel like it is our fault. Like I did something. I must be a terrible person if you're doing this to me.
Mhm. Yeah. And that's one thing I feel like I still kind of struggle with is the lack of control in the situation and having not been pregnant again and not having a living child. It's like, what do I have to do? Like, just tell me what to do. Tell me what pill to take. Like, there's got to be some secret that I'm not in on. So, that's hard to not make yourself crazy with those thoughts either.
The other thing that I found like really frustrating about your story is how many times you were like dismissed by doctors, like not listening to you, like, oh no, it's fine, like come later, it'll be fine. Oh, don't worry about the discharge, don't worry about this. And it's like nobody was listening.
Yeah. Yeah. And that part is very frustrating. And something that I realized I left out of the twin story is when we went for our anatomy scan, the ultrasound tech was really nice. We were talking and I was looking at the screen and I saw this little like blip on the screen. And I was like, oh, what is that? And she's like, oh, it might be a Braxton Hicks, but I'll check again. And if it's still there, we'll do a transvaginal. And I'm like, okay. So, we continued talking. She wrote down the genders for us and we were all excited because we were going to find out the genders. So my husband and I left. And on the way home, I told my husband, I'm like, oh, she never brought that up again. So it must have went away because she said she would have checked if it was still there. So then like looking back and thinking back after we lost them, I'm like, would we have found that out? And could we have, gotten a stitch? Like, would it have shown the funneling? So it is hard to like not question things, and it's hard knowing that a lot of doctors have dismissed things and just I don't know. You have to be your own advocate, and it's frustrating, it's exhausting, it's unfair.
It is. And, I really hate that with the incompetent cervix that, like you were told that they don't find out you have it until you've already lost a baby. And that I just don't think it should be like that. Like
Mhm.
why did this many babies have to be lost before you just add a simple check
Yeah.
to
Hmm.
an already like regular scan?
Yeah. It doesn't make any sense.
It's like you said, we would pay for it. I would happily pay out of pocket for extra ultrasounds for like anything. Like,
Mhm.
don't
Even
even fight with the insurance. I'll pay for it.
yeah, exactly. Yeah. And that's the thing. It's like, yeah, that might not work, like catch it 100% of the time, but it can catch it. So why would you not just do it? Especially a woman's first pregnancy, you
Yeah.
know, and every pregnancy matters, but especially if you knew like the struggles to get there, the mom's gonna, want the extra peace of mind. As many bad doctors or dismissive doctors I've had, I do have my IVF doctor and the high risk doctor who still works with me, even though I'm not pregnant, are the epitome of what doctors should be. You can just tell they really care about their patients.
I think that's amazing that you've been able to find good doctors too, to make all the bad ones
Yeah.
not as bad, you know? I
Yeah.
mean, it's still bad, but it's like, there are people on your side helping you.
Mhm. I know. And they're older, they're on the older side. So I'm like, please don't retire yet. Like, just wait.
My OB at the time when I lost Jasmine, he had to go out of town as well. And I was like, okay, I mean, yeah, they should be able to go out of town whenever, but it's like it always seems like when they do, that's when something
I
happens.
know. Hmm.
And then he came back and yep, I had her. But
Yeah.
he did come to see me at least, but
Yeah.
it was yeah. Like y'all aren't allowed to go out of town anymore. Bad things happen.
My husband and I joke about how we wish we could just like have a personal doctor, to call 24/7 or just like to be there monitoring us.
I know. I'm like, I'll pay for that too.
Yeah.
You give me like ultrasounds every day or something. I don't know. Heartbeat checks, just anything like to help with the crazy anxiety.
Yeah, and the anxiety is crazy. Like I want to be pregnant again so bad. But and this is like infertility too. You just question everything you're putting on and in your body, and to the point where it's just like driving you insane.
Yeah. Well, especially when it's hard to not think about like, I was mad too. Like, why do I have to deal with PCOS? Like, because I was reading about like the PCOS diet and it's like, okay, you can't have sugar, you can't have caffeine, you can't have dairy, you can't have gluten. I'm like, what can you have? Like, why do I have to deal with this?
Just water? Like, is that it? Yeah.
I know. And then it's just like, other people don't have to do this.
So unfair.
But yeah, I'm not very good at doing the diet part. I need to be better about that. But it's like, it's just a lot. And yeah, you question everything and you want to do everything possible. Like you said, like I drank the pomegranate juice, ate the pineapple, did the whatever. It's just like anything that could help.
Yeah. Yeah. And then at some point, like you said, like with the diet and stuff, at one point you gotta weigh out like, okay, is this helping or is this like causing too much anxiety and hurting?
Right.
Like I feel like it can be a fine line sometimes.
Yeah, I agree. And I think, like we've talked about that mental health is not seen as that important. Well, you better be doing this if you want to, have a chance at a baby. But it's like, yeah, but my mental health is important too. And I'm stressing over this and it's not helping.
Yeah. Oh yeah, I stress about stressing. Like
Yeah, I do that too. I finally had to like this, no, it was last year. I finally had to go on anxiety medicine because I've dealt with anxiety like my whole life. And I'm just like, I can't do this. Like I need
yeah.
because yeah, I
Mhm.
do. I told my mom, I was like, I'm pre-stressing. I'm stressing because I don't know. Like, yeah, anxiety is bad sometimes. I hate it.
Yeah, it is. It's rough. It's very hard.
So is there anything else that you'd like to share or add?
I don't think so. Just thank you for letting me come on your podcast and tell my story. And I hope if anybody is listening who is pregnant, fight on the 19th week or the anatomy scan to have them check your cervix. Just ask, say, does my cervix still look like it's closed? Because, yeah,
Yeah, you'd rather be safe if possible, like anything. So
advocate for yourself.
yes, very important. Well, I want
Thank
to thank you
you.
so much for coming on today and sharing your story.
Thank you for having me.
Thank you so much, Randi, for sharing your story with us. As we talked about, it seems so unfair that any of us would ever have to go through loss. It's unfair that people have to go through multiple losses. It's unfair that people have to go through both infertility and loss. We all have our own struggles, and it can be very hard to not compare your struggles to others. You may think, oh, mine isn't as bad as theirs. Or you may get annoyed at someone else for grieving so hard when you think what you've been through is worse. But let's stop with both of these mindsets. Everyone grieves differently, and everyone has their own story and challenges they have been through. We can't judge what others have gone through. We only know what we've gone through. There are really no benefits of comparing your loss and your journey to others. Focus just on what you need to grieve and try to be supportive to what others are going through. Infertility and loss is hard for everyone. And as a community, I think it's just really important that we always do our best to be there for each other. Don't forget to subscribe so you don't miss any future episodes. If you like the show, please leave a review or rating on Apple or Spotify. It only takes a moment and really helps the show reach more loss and infertility families. Thank you so much for tuning in, and remember, we are all in this together.